Hello, we're back, you guys. My name is Dr. Abby, and I am a chiropractor here at CHIRO for Moms, CHIRO for Kids, and CHIRO for Chiros, and you found our YouTube channel, so welcome. If you've been here before, if you're brand new, just a nice refresher on kind of who we are as a clinic, as providers, the whole over-under. So we are a specialized clinic in the Twin Cities, and for YouTube purposes, we provide a lot of educational content, not only for patients, but also for providers out there who are, one, looking to niche down their clinic, looking to specialize the people that they treat, the environment in which they're in, but then also tips for being a cash practice. I know it's becoming more and more common for chiropractors to be an all cash practice, but especially if you've been in practice and you are making the transition from insurance to cash, there can be a lot of questions, and who better to ask than people that are doing it. So for today's video, we're going to talk about niching down, and specifically in the niching down, we're going to talk about products. So we've talked a little, oh my God, a hair sticking up. There we go. When we talk about products, and we might have mentioned it before, so we have a whole array on our Amazon storefront. So make sure you check out how to set up an Amazon storefront. It is so important when you're looking to make a little more passive income in terms of running a chiropractic clinic. But products specifically, we don't sell anything here. We don't sell supplements. We don't sell the bands. We don't sell Element. We don't sell anything in our storefront. It's just, we aren't a store. We want to focus on giving that chiropractic care. And also, no one should ever feel pressured to have to buy something on the spot. So in our email, I always include the products we talked about in office. But what you can do as a provider, and what I encourage you to do, is all the products that you have on your storefront, you have in your office in one way, shape, or form. So before someone goes and buy anything off Amazon, I'm using Amazon as an example because most people, that's where they do a lot of that shopping. There are some things that we use here that are not on Amazon, and that is for a different time. But I'm going to use Amazon as an example because everyone knows what it is for the most part. While it's easy to return things on Amazon, it can just be annoying and frustrating. And if you were talking to a new mom, the last thing that she needs is another thing on her to-do list. So we keep everything here in office. We typically have about 4 of each product, at least for our kind of like big 5 products. We always have 4 on hand, so that allows 1 in each of the treatment rooms, and then we have 2 extras. So let's take a product, for example. When I recommend an SI belt to a woman, I want to, 1, make sure they know how to wear it. So I always describe, and I'm like, reminder, I have a video though, but it's gonna sit lower than you think, and I want you to know how it feels. I want you to know how it feels walking around, because if they're walking around, they're like, I don't notice that much of a change, then don't buy it. Like, it doesn't make sense to recommend a product if they know it's already not gonna work. But then secondly, I want them to know how it feels. So when they do buy that product, when they use that SI belt, they want to know what it looks like. 2, if it's sizing matters for certain products, that they know what size they might need. And then also, it is a good refresher on how to wear it. People don't want to buy something if they aren't quite sure how to use it. We have 1 in each room, so that way, no matter who's treating in what room, they always have that on hand. It makes a little less chaos running from your room to room. Well, sometimes they occasionally end up in the same room, so that's always fun. We just get to say hi. But then secondly, we keep a couple on hand. So there's usually about 1 patient every couple weeks, and they are in so much pain. They typically are last-minute call-ins. They have to get in right away, and you can usually tell by the sound of their voice, the tone of their voice, that they gotta get in. So they get in, we make them feel good, right? But I want to make sure that they're supported outside of the clinic. I don't want to have them have to come in 2 days from now. And maybe they want to, and that's their decision at the end of the day. But I want to make sure that they feel supported. So we keep, especially the belts, we keep 2 belts in the back. So if we have a patient that's coming in and they are in that much pain, I'm going to send them home with 1. You take that cut, right? You send them home. You're like, you were in that much pain, and I never let them refuse it. I said, go home. And I want you to be wearing this, right? Amazon, 2-day delivery. I still want you to have it these next 2 days. And sometimes people return it and sometimes they keep it. And that is besides the point. But having that on hand to give to them so that they walk out literally feeling better when they came and they feel supported. But on the emotional, mental side of that, the amount of trust that your patients are going to have in you for you to give them a product free of charge, to walk out of the clinic with it, says, I care more about you than I do that you came in for your appointment, right? I don't care about the money. I care that you feel good, because it's not fair to anyone to be in that much kind of pain and then feel like they just get charged and charged. Another great example, we keep Element on hand. We usually have a box in the back for anyone that maybe might be leery about the flavor, because you only can buy a variety pack of 8 or the 30 pack. What if they don't like it? That stuff isn't that cheap, but the product's amazing. So if they like it, it's great. But if they don't, then they're kind of just stuck with it, where I'm like, I just want to send you home with one. And if you don't like it, then and you know what it tastes like. But if you do, you also know what it tastes like. I'll just link the box in your email. So if you want to get it, you get it, and all the different things that come with that. But you're instilling the trust to your patients that I care about you, not necessarily about you coming in, you paying for the appointment, and you sticking around. Because if you build that trust, they're going to naturally come back, because they know that you care about them, not the fact that they are there as just a person. So keep that in mind when you're looking to build your Amazon storefront, when you're looking to maybe restructure how your room is organized, how the office is organized. Where can you keep some of those most common things on hand, things that are going to change that person's life for the day, for the 48 hours, for the week, however long it is, whether they get their own or not. Have those things on hand, change some lives. Know that they will appreciate that more than you can ever imagine. If you have questions about what kind of products that we keep on hand, I encourage you to check out our other YouTube videos, especially setting up an Amazon storefront. More content to come on overall product usage. It's one of our favorite things to help support women beyond just the chiropractic care. So subscribe, let us know what you need, leave questions in the comments below, and have a fabulous rest of your day.